What is prodromal versus clinical high risk? When discussing schizophrenia, it's important to understand the terms prodromal and clinical high risk. These concepts help us identify individuals who may be on the path to developing this serious mental health condition. Let's break down each term to see how they differ and relate to treatment options. Prodromal refers to the early stage of schizophrenia. This phase occurs before clear psychotic symptoms appear. Individuals in this stage may notice subtle changes in their thinking, mood, or behavior. For example, they might experience trouble with memory, difficulty focusing, mood swings, or mild depression. The prodromal phase can last from weeks to several years, but it often extends beyond 1 year. During this time, symptoms are not severe enough for a full diagnosis of schizophrenia, but they indicate that something is changing. On the other hand, clinical high risk, sometimes referred to as ultra-high risk, describes individuals who show early warning signs or risk factors suggesting they might develop a psychotic disorder like schizophrenia. The criteria for clinical high risk help identify those who are more likely to transition from the prodromal phase to full psychosis. These criteria include having mild or brief psychotic symptoms, a family history of psychosis, or a recent decline in functioning. The aim of identifying clinical high-risk individuals is to provide early support and treatment before more serious symptoms develop. Both the prodromal phase and the clinical high-risk state are closely related in research and clinical practice. The prodromal phase highlights early symptoms and changes, while clinical high-risk refers to a specific group of people most likely to progress to psychosis based on defined criteria. Recognizing these stages is essential for early intervention strategies in schizophrenia. When it comes to treatment, identifying individuals in either the prodromal or clinical high-risk stage allows for timely support. This can include medications such as antipsychotics or antidepressants, along with counseling options like cognitive behavioral therapy. Early treatment may help reduce the severity of symptoms and lower the chance of developing full-blown psychosis. In the realm of schizophrenia research and new treatment developments, focusing on the prodromal and clinical high-risk stages is vital for improving outcomes. By recognizing and addressing these early warning signs, clinicians can offer targeted support that may prevent or delay the onset of more serious symptoms. This approach is central to current efforts to develop better treatments for those at risk for schizophrenia.